This is just an introduction to psychiatry. In between, if you feel free, you can interrupt me and ask some questions also if you want. And for a healthy mind, I had titled this, for the World Mental Health Day. Do you know when which date is the World Mental Health Day? Anyone? You can unmute and say if you know. I hope you know. This October 10th of October, 10/10. And last year, the World Mental Health Federation and WHO put the topic. Every year there would be a theme for the Mental Health Day. Last year the theme was mental health in an unequal world. So our world is unequal in various aspects, and it is very much important. I mean, of course, much of physical health of people was affected in the last 2 years because of COVID. And mental health also was equally or even more affected because globally the stress levels have increased, and people became more stressed out and depressed, and there were many suicides, and much of financial difficulty, loss of job, financial difficulty, loss of job security, and loss of relationships. So many things, so many untoward incidents have happened. And in the midst of all that, as medical students, it is at most importance for you also to know what are the main psychiatric symptoms and how to deal with them in a primary health setting level, as well as how to refer them whenever appropriate, how to identify. Because many of the people who have mental health problem also present with many physical symptoms. They would be presenting in the medicine OPD with headache and loss of appetite, and they would be having many physical. So they can present with many physical symptoms. As we say, there is a mind-body relationship. Our mind and our body are very much interrelated, and they would be presenting with many physical symptoms. And of course, we should rule out all the physical causes also. Sometimes actually it would be due to physical causes only, but sometimes it would be due to psychological causes. That unfortunately, many physicians also in the busy OPD setting, they might fail to recognize that, and then the cost of treatment would be going up. People experimenting one medicine after the another, but with no benefit. Finally, somebody would be, like that many cases come to us actually. So finally, somebody would be saying that you go and see a psychiatrist, and actually there would be much stigma among patients also, and unfortunately among doctors also about psychiatry, about the psychiatric medicines, and all misconceptions are there. Although there are many good advanced treatment and medicines are there. So one simple acronym is all right, that we can all right, ALRIGST. So approach, or how we approach the patients, how we listen to them, how we reassure them, how immediately we can guide them to the proper help, and how we can guide them, and how we can instill hope in them, and how we can spend time together with them and give them support, and how we can help them all together. So this is actually this slide is shared. This is shared in my Facebook page also. If you search in Facebook Dr. Sandeep Psychiatrist Karunagappally, you will get this slide. You can get this image also. And so are mental health problems similar to other health problems? In one sense, it is similar only. When we have some cardiac problem, we would go to a cardiologist. When you have ENT problems, we'll go to ENT surgeon. When you have some eye problems, we'll go to an ophthalmologist. But when you have mental health problems, actually people tend to go to various people, and many people, because of various reasons, they are very reluctant to go to a psychiatrist because of the stigma. So each one of us has to change our attitude towards this mental health problems. And how do commonly people develop mental health problems? In simple terms, you can say, of course, there are nature and nurture. So genetic factors are there, as well as environmental factors are there. Of course, genetic factors in varying proportions are there in all of us in varying degrees. Genetic preponderance are there. In some families, it might be a little more. Some families, it might be a little less. But nurture, that is the environmental factors. Nature versus nurture. Nature is the genetic factors and nurture is the environmental upbringing and all the environmental factors are nurture. So these are nature as well as nurture play an important role in the development of mental health problems. So in simple terms, you can say stress is one of the most important cause of mental health problems. How stress results in people's life because of various problems in their life. Stress is like a burden upon their mind. Just like if there is a burden upon our head, we have a pressure upon our whole being. So like that, if there is a burden upon our mind, that we can call as stress. And it can be the problems, can be some failures in our own life, problems from other people. Some people behave in a manner that we do not like, or some people do not behave in a manner that we like. Or there can be even so circumstances that happens which contrary to our expectations. There can be fights within the family, outside family, financial problems, loss of business, loss of reputation, loss of property, loss of relationships. Loss of relationship like break of love affair and all are very common among campus students and all. And failure in studies, job, competition, even in election, and disease or death, especially after the COVID pandemic, the morbidity and mortality has increased exponentially. And work overload, some section of society stress that they do not have any job. Some other section, they are overloaded with overloaded with jobs. Many people come out of all those difficulties with their faith in the God who created them. They cast all their burdens into the Lord who cares for them. As we know that verse in 1 Peter 5:7, cast your burdens into the Lord because he cares for you. And so many people are able to come out of all those difficulties because of their faith in God. And some people resort to hobbies and support from family, friends. We all need all these. But some other people keep on thinking about the problems. They brood over their problems, and then they keep on thinking about one particular problem. Their focus is only on the problem. They are not able to count the blessings in their lives, but rather they are only considering the problem in their life, and then they would be affected in their minds. There would be some neurochemical changes in their brain that will result in changes in behavior, which manifests mental health problems. This can be, simple depressive symptoms or anxiety symptoms, or we can go to extremes like psychosis and mania and all. For a quick screening, one or two questions that we can ask is: how is your sleep? How do you feel? And all. And if we cannot go and ask everybody, do you have any psychiatric problem? They would feel bad and embarrassed. People don't like to be asked such questions straight away. But actually, we can ask: how is your sleep? How is your appetite? How do you feel in your mind? Is anything worrying you? Is there any stress or problems in your life? Are you depressed about something? Are you too anxious about something? And for men especially, the substance history also, we can take alcohol and cigarettes and BDs and tobacco, handspan, gutka, tobacco powder, ganja, all those, and all the many, more synthetic substances, MDMA and LSD and so many things. It's sad to know that those things are becoming more prevalent among even medical people, and there are reports that these things are becoming more and more rampant in our campuses and all. So, what are the common symptoms of mental health problems? So, these three symptoms, which are there in the current slides, are actually the triad of depressive symptoms, the three cardinal symptoms of depression. So, if you get a short note on depression or even essay question on depression and all, of course, depression can present as a symptom, and there is a syndrome of depression. When there is a cluster of symptoms in that kind of a presentation, It can be depressive syndrome. So depressive syndrome, the main cardinal symptoms are, one is from the word depression itself. The word depression means what? Sadness. So pervasive low mood, that excessive sadness, that is one cardinal symptom. That especially for more than 2 weeks is the time criteria that we say to label it as a depression and all. Of course, other physical factors like thyroid problems, vitamin B12 levels, vitamin D levels, and hemoglobin and other routine parameters, and all the usual physical problems and all have to be ruled out. But in the absence of all that, this excessive sadness lasting for more than 2 weeks, along with lack of interest in anything, anhedonia. Anhedonia means lack of interest. So lack of interest in any previously pleasurable activities. That is, anhedonia, lack of interest, and excessive fatigue. They feel like lying down all the time, excessive tiredness, and easy fatigability, decreased energy levels. So that these are the 3 cardinal symptoms of depression. And of course, along with that, they will be having difficulty in interacting with others, impaired social interaction. They don't want to face anybody. They would be keeping themselves aloof in their room. They don't want to talk to anybody. Of course, people with anxiety, anxious personality disorder, and all, because of the anxiety, although they want to interact with people, they are not able to interact with people. That is a little different. But this is because of the depressive symptoms. Mostly, they would be proceeding some stressful life event and some failure in some exam or some financial loss or something. Somebody misbehaving with them. Some calamities in their life or something would be there, usually preceding the onset of all these symptoms. Sometimes we may not be able to pinpoint to a particular stressor, but there would be a series of stressful life events and a series of things that would happen that would eventually result in the negative pattern of thinking, resulting in this depressive symptoms. So difficulty in social interaction and sleep problems. Sleep problems include difficulty in sleeping, less sleep, as well as sometimes actually in a typical depression, there can be more sleep also. They would be sleeping for more duration. Usually the optimum duration for sleep that we say is actually 7 to 8 hours. Preferably 8 hours of sleep, not less than 7 hours of sleep is what we Sleep Research Foundation and all recommend for younger and older adults. Of course, in children, they require more sleep. Younger and older adults, 7 to 8 hours of sleep. So if it is excessive sleep also, and also if there is less sleep also, there can be problems. And of course, thoughts and threats and writings or attempts of suicide. So that is also one of the symptoms of depression. So sometimes, the idiom barking dog seldom bite is actually not true with regard to suicide and depression. In suicide and depression, barking dogs, they do bite, not seldom bite. When they say about depression, when they talk about depression, when they threaten and all, we shouldn't take it lightly, because even research have proven that most people who have committed suicide or attempted suicide have already voiced it out to their family members or friends, but everybody ignored that, or they didn't get adequate treatment. Like that, it is true. So a common myth about suicide is that, or those people who talk about depression, they never attempt like that. There is a myth actually. The converse is true. Those who attempt, usually they would be saying it to many people, but nobody would be able to help them out, and they get ignored. And sometimes the suicidal attempt itself would be a cry for help. Sometimes after somebody attempts something only, the family members take it little seriously, and they would take him or her to a doctor, or the doctor would refer to a psychiatrist and or a counselor and all. But otherwise, actually, people would be ignoring, just say it is all your thoughts only, just change your thoughts. Like that, actually, people would underestimate people's symptoms, and the quality of life of many people get affected, and they are suffering. There are many silent sufferers in the community. And because you people, most of you are medical, I believe all of you are medical students. And so even if you specialize in a subject other than psychiatry, of course, there would be many people who would be presenting to your OPD in your wards. Even the family, the caregivers also, with who need some support and guidance and all. So there are many things actually we need to we need to be watchful about all these symptoms in the common population, even among your friends sometimes, even among your family members. There can be these kind of symptoms, and also stress as a symptom. The feelings of stress and anxiety, increase or decrease in speech. Usually in depression there would be decrease in speech, but sometimes in agitated depression there would be increase in speech. They would be speaking all the more. Recently there was a lady whose husband died suddenly of COVID. Some months ago she presented, and she was she was brought by her brothers and all, and she was keeping on speaking, and she was relevantly talking. She was not in a hypomania or manic mode, but actually she was in that agitated depression. She was very much depressed, but actually she was very much agitated, and she was finding it difficult to say relevant things, and so like that there can be increase in speech even in depression also. And the opposite of depression is mania, where all these things would be in excess actually. That also I'll just come to. So in depression there can be impaired attention and concentration. So actually I'm enumerating some symptoms. All these sometimes actually these depressive symptoms also can be part of a psychotic syndrome and all. So there can be varying presentations, but the main symptoms I'm enumerating. So decrease in attention and concentration, loss of appetite, fear, suspicion, all those things can be there in depressive symptoms. And the opposite of depression is mania, and milder form of mania is hypomania. And so in mania, the opposite of all these are there. So this is the first slide about depression. So in mania, there will be elated mood, elated or irritable mood would be there. The three cardinal symptoms of mania is, you can write down, it is elated or irritable mood. And there will be increased energy levels. Instead of excessive fatigue, there will be increased energy levels actually. They will be keeping on wandering and roaming, and they will be doing increased goal directed activities would be there. Will be keeping on doing something or the other. And instead of lack of interest in anything, they will be increased speech also. They will be keeping on blabbering something, and so like that is the opposite of mania. So when there is manic episodes as well as depressive episode, or if there is more than one manic episode or hypomanic episode, it is called bipolar affective disorder. And then actually there is this syndrome of psychosis. So in psychosis, mainly there would be fears and suspicions. So in this slide, you see the fear and suspicion. So fear and suspicion, in psychosis, the main cardinal symptoms, actually I'm just enumerating the layman's terms of all these symptoms, but actually the symptoms of psychosis, mainly the features of psychosis are mainly delusions and hallucinations, and also disorganized behavior and disorganized speech. So delusions and hallucinations, delusions are false fixed beliefs which are not shared by others in the same socio-cultural background. So example for a psychotic symptom of a delusion is most commonly they would be having persecutory delusion. Persecutory delusion means delusion that is a false fixed belief that others are all against me, or others are plotting against me. Others are, many of people in our social culture background will say that they are doing black magic against me, they are plotting against me, they are chasing after me, they are all against me. Like that, there are many enemies. Of course, there would be nothing, but they would be having this false fixed belief that others are all against. That is a persecutory delusion. And there can be a referential delusion. So all these come with symptoms like bhayam, sandeham, that is fear, suspicion, and all. But actually, we have to elicit whether this is persecutory delusion or referential delusion. Referential delusion is nothing but people firmly believing that all others are talking about them. They will be saying that all the people in the neighborhood are looking at me, they are referring to me. People going in the streets are all laughing at me, they are referring to me. Even the signboards and even the newspapers all have some reference to my lifestyle. They are all referring to me. Even the people in the TV, they are all talking about me. And people in the news also, in the news items also, they are about me. Like that, they will be saying that is a referential delusion. And sometimes you would be hearing some non-existent voices also. I'll come to that slide. But here there is another symptom that is mainly in the context of PTSD. You might have heard that term PTSD, post-traumatic stress disorder. So they would be re-experiencing of the trauma through intrusive, distressive recollections of events and flashbacks and nightmares and in children there would be repetition of some repetitive play that may occur in which themes or aspects of the trauma events are expressed. That means actually people who face much intense trauma, like some flood victims, some rape victims, war victims. Recently, there were some people who came after they resigned from the Afghan military. In Afghanistan, the US military base, some people were employed. When Taliban took over and all, many of them came back, and some of them had this PTSD symptoms. They were hearing the missile attack and the grenade and all those sounds and all are coming as flashbacks, and they're not able to go to sleep. So they were having this, sometimes actually even after witnessing some road traffic accidents, some death of a loved one, seeing somebody having committed suicide. So like that, all those flashbacks and all those things comes as nightmares and flashbacks, and they would be avoiding the traumatic reminders. They do not want to go to that part of the road where they witnessed the incident, because all those old memories come to their mind. And there will be persistent sense of current threat that is manifested as exaggerated startle and hypervigilance. Hypervigilance. They are all the time as a hyper alert state. There will be an emotional numbness. So like these are some symptoms of the PTSD. For depression as well as PTSD, antidepressants, sometimes to calm them down, some doses of antipsychotics and all are needed. Psychopharmacology, we have already studied about antipsychotics and antidepressants and all. And sometimes it would be some anger control problems that would be the preceding problem. Anger control problems can be part of psychosis, it can be part of depression, it can be a personality problem, it can be just a behavior problem. So like that, in various contexts, we need to see all those symptoms are there. We need to see which syndrome it is part of. We need to elicit and see the context and, learn to delineate where we should categorize each symptom. And there can be some unexplained physical symptoms. That was what I was trying to say in the beginning also. They would be presenting with physical symptoms like headache and body ache and numbness and pain and paresthesia and all. But all the physical symptoms are ruled out. Sometimes actually even there is something called pseudo seizures. I don't know whether you're familiar with that term. You all have heard about seizures. And there is something called false seizures. That is pseudo seizures. Or it is called dissociative seizures. That is, it is not the true seizures where there would be loss of consciousness and all, but they would be retaining the consciousness inside, but they are not acting also. But because of the excessive stress, they are not able to contain that, and that would manifest as some this kind of a manifestation where there would be some jerky, convulsive movements, but they won't be able to respond to when other people are talking to them or calling them. But they would be having consciousness inside, but they won't be able to respond. There can be some dissociative fainting attacks and all. So there will be unexplained physical symptoms. The physical causes are not there, but it can be psychological causes like stress. And then I was saying about the hallucinations in psychosis. The main symptoms are delusions and hallucinations. So hallucination can be of any senses, like auditory hallucination or visual hallucination or olfactory hallucination or gustatory hallucination or tactile hallucination. So most common hallucination is auditory hallucination. That is hearing voices in the ear when all alone, hearing non-existent voices. That is, even when nobody is talking, you are hearing somebody talking to you. And these people tend to talk back. And when we see them, we'll be seeing them talking to themselves. Sometimes I think the streets and all, unfortunately, some people will be there going, sometimes today with Bluetooth earphone and all, people would be seen talking to themselves. They would be talking of the Bluetooth phone only. Don't misunderstand them. But there would be people who would be muttering to selves and smiling to self and talking to themselves, and this can be the hallucinatory behavior. They would be responding to the auditory hallucination they are having. Even young people with young onset psychosis, and even in late onset psychosis, even in delirium and demented patients with psychosis, and they will be having all these kinds of symptoms. And because of psychosis, there can be violent behavior. Because of personality problems, there can be violent behavior. Because of mania, there can be violent behavior. So all these can be part of, all these are symptoms which can be part of many syndromes. And suspecting spouses, that is wives or husbands' fidelity, faithfulness, falsely. Even if there is no extramarital affair, the husband is suspecting the wife, or the wife is suspecting the husband, or even, even if the marriage has taken place, the person, the boy or girl, is suspecting the lover. And it can be like a delusion of infidelity. Just like there is a delusion of persecution, delusion of reference, there can be delusion of infidelity. That is a very terrible thing, where even sometimes actually many murders and many conflicts in families and many broken families and all have occurred, have taken place because of the lack of treatment, because the treatment was not given to the patient at the proper time, and unfortunately the patient wouldn't have any insight. So very thankfully we need to deal with such families, and but actually with treatment, actually they just improve dramatically. That is if you give a good dose of antipsychotic, all the suspicions will vanish and they will come back to their normal life. Recently, I mean, many people we see every day. Even recently, one elderly lady was suspecting her husband, the children, the son and daughter, had come and actually, and when we gave her medicines, now she's back to normal. Then actually we see many cases like that. But unfortunately, because of the delay in treatment all those years, they have been suffering hell in their home, because every day they would be fight and quarrel and using bad words, and in that chaotic atmosphere, the poor children are growing up. So like that, there are many people, they would be ashamed to tell about their symptoms, especially when it is especially when the symptoms are in their old age parents and all. They would be finding it very embarrassing to come and tell it to a doctor. And of course, these are things that our people in our community face. And sometimes, of course, because of all this internet and all these things, there would be true extramarital affairs also in people nowadays, even not only nowadays, in every century, but especially all the more common these days also. So it can be delusional, it can be a true thing. So whatever be that, we may need to deal it in that wisdom and tactfulness, and that wisdom. And neglecting one's personal hygiene, not taking bath or cleaning oneself, and not welcomed like that, and not going for work for no reason. All these can be part of psychosis, and all. It can be due to depressive symptoms also. Not going to work without any reason. They are not going for any work. They are just sitting idly at home. They feel that there can be a delusion of control. There is feeling of being controlled by an external agency. Somebody is controlling me. Or in rare cases, it can be demon possession and all. That would be very minority, very small fraction of cases would be genuine demon possession, and as we Christians can understand that from the Bible. But I myself have cast out demons in the Lord's name, in Jesus' name, in my OPD. But that is actually very minor, a small fraction of patients. But mostly it would be just the psychotic symptoms only, which can be just controlled and managed by the antipsychotics. And other strange experiences. The unfortunate thing is that some people blame demons for everything. So, even just the stress-related symptoms and all, people give credit to demons and Satan, and they manipulate and mistreat, and many people go to unnecessary guilt, and they are not being really helped. And other strange experiences and behavior like that, many psychotic symptoms and all are there. Then this OCD, recurrent irrational thoughts, are called obsessions. Recurrent irrational ego dystonic thoughts, images, or impulses. That is OCD. Then irrational thought, just like the classic example is recurrent feelings, recurrent thoughts of being unclean. That is obsession of contamination. They feel that their hands are dirty, although they know that their hands are clean. They get that thought that the hands are dirty. So in order to ward off the anxiety because of that obsession, they want to do some compulsive act, compulsive ritualistic act like repeated washing. So that is compulsion of washing. So obsession of contamination, compulsive washing. Like that obsession, there will be pathological doubt and compulsive checking behavior, and there will be obsessions of blasphemy. That actually they would be, many people will be having obsessions of bad thoughts about God, and they feel very guilty about that. Obsessions. They know the irrational thoughts, but they do not want to have those thoughts, but those thoughts are coming again and again. And because of the guilt, all the more the obsessions would be coming, and there would be sexual obsessions also, and like that, varying things of obsessions. So that's one great topic, OCD, obsessive compulsive disorder. When the obsessions and compulsions occur in a disorder level, it is OCD. Then the memory problems, it can be just the normal memory problems like absent-mindedness syndrome. It can be dementia in old age. It can be due to memory problems due to even some vitamin B12 deficiency, thyroid problems and all. It can be memory problems due to lack of revision and all, as we commonly face in your student days and all. So like that, memory problems in food intake, either excessive food intake like bulimia, nervosa, or less extreme decrease in food intake like anorexia nervosa and eating disorders, another category. And sexual problems without any physical causes, there can be many sexual misconceptions and sexual problems, and there is another topic in great detail. Then addiction to substances, addiction to internet and pornography, addiction to video games and social media, addiction to various substances, personality disorders, the maladaptive character patterns of personality disorders, paranoid personality disorder, obsessive compulsive personality disorder, narcissistic personality disorder, passive aggressive personality disorder, like that, various schizoid and schizotypal, and like that. There are many personality disorders. And then interpersonal conflicts, family problems, marriage-related problems, which more of counseling are needed, more of conflicts, interpersonal conflicts and family problems. Sometimes because of the depression and psychosis, these family problems and marriage-related problems will be there. Sometimes it will be just the behavior problems, understanding problems and all, where more of counseling are needed. Then career and job-related problems, learning problems, behavior and problems in children and teenagers. The learning problems can be due to decreased IQ, decreased intelligence quotient, and there can be guilt, spiritual conflicts. So like that, these are many, a series of symptoms that I enumerated. And many hurdles are there for people to approach the psychiatrist because of their stigma, ignorance. They worry about side effects of medicines, whether they worry that the medicines are addictive. Actually, only one group, benzodiazepine group of medicines among the psychiatric medicines, only are addictive actually. But actually people fear that all the medicines are addictive. And even benzodiazepines, we would, a good psychiatrist would be prescribing even benzodiazepines only in a very rational way only. Only inevitably benzodiazepines will be prescribed. That you for a short term, as much as early as possible, you'll be trying to taper it off and all. But actually, the common misconception about even among medicos, then not to say about the layman, that all the psychiatric medicines are very costly and they're very addictive and all. But actually, all the converse is true. Worry about the cost of medicines and all. Of course, government and all are supplying all these medicines free of cost also. And addressing the stigma, we need to understand that there are many different categories of psychiatric syndromes. Many people think that, oh, if I go to a psychiatrist, everybody will think that I am mad, or I have Vaidyam, or I have, that kind of words they would be using. But actually, for the florid psychosis and mania, actually would be comprising a very small fraction of patients only. Majority of the patients that would come to us would be having some stress-related symptoms and sleep problems, some anger control problems, some smaller issues only. But because they fear that they would be categorized along with the severe psychotic patients and all, they would be reluctant to approach a psychiatrist and get treatment. So another thing that we need to understand is that these symptoms are very common, and anyone can develop at any point of time, and not always medicine. Sometimes even just counseling be enough for some mild, beginning of symptoms, and sometimes actually counseling would be enough. And for addressing the stigma, we need to clarify misconceptions. These are no lifelong medicines. Once the symptoms are free and everything is stable, we can slowly taper off the medicines in most cases. And these are not addictive medicines, and we can give the minimum effective dose to minimize side effects. There are many good effective medicines without any significant side effects. And of course, we need to change the attitude towards everything, and prompt treatment, the earlier the better. This is not something to be covered up. Because the neurochemical changes can worsen with time. Suicide may be unpredictable. We may not have the patient when we think that next week we will help him or her. That suicide and all can be unpredictable. And sound mind in a sound body. That's why mental health is very important. Even our physical health is very much dependent on our mental health. Our mind and body are very much interrelated. So problems in your mind like fear and anxiety can affect you physically and make you physically weak, and have more of stress hormone production and can decrease immunity, and you will be prone to many bodily problems. And the converse also, even physical ailments can affect your mental health also. So both ways there would be dual interaction. And there is no to suicide, how suicide is a cry for help. The situations will change. Even if suicide attempt is the four things I usually say, when people say about the suicidal tendency, and whatever situation that they feel hopeless, of course, will change. And even if you try to attempt suicide, if it is unsuccessful, there would be medical complications and guilt and shame, and all. Even if it is successful, think about the sorrow of your family and your loved ones, and all. And above all, you are accountable to God. Even if whatever do you do, you need to give an answer to God. There are so many people who are trying to live, spending lakhs of rupees. They are taking treatment to live, and you are trying to die. So, you are accountable to God. And of course, there are many medicines which help you to feel better and tide over the situation. So, suicide is not a solution to anything. And about positive stress, and of course, I don't have time to go through all that. I think my 30 minutes is over now. And the stress management, the 5 aspects: spiritual, psychological, physical, diet and exercise. So this is one verse which one of my clients, with my request, has designed for me when I was in Karigiri in Vellore. So he was a designer. So he came for counseling, and he showed me some photos of some verses which he had designed like this. So I asked whether you can prepare a slide, prepare an image with this concept I said, and I put it in my Facebook cover page, as well as it is framed in my OPD even now in Tamil and English. It is still over there in my OPD. So many of us are like this young boy with a heavy burden in a dark, dim face. But if we cast all our burdens unto the Lord, we can rest like a little child in the Lord's arms. So Jesus says, "Come to me, all who are weary and heavy laden, and I'll give you rest." So that is He is the greatest physician, greatest psychiatrist. And our stress management in a spiritual way, our relationship with the Lord, and time with the Lord and His Word, blood of Christ cleansing guilt of our sin, word of Christ edifying and empowering our spirit, and cross of Christ, where we surrender everything to the Lord, and the Holy Spirit empowering us, and the body of Christ, the fellowship. All these things will help us walk with the Lord and to overcome stress. And of course, these slides I prepared to present gospel to some medical students some years ago. So deep and repentance and all are mentioned over there. We'll just go through the slides. Cross, where we surrender everything to the Holy Spirit, the bread of life, fellowship. And the purpose of our life is to have fellowship with the Lord and to become like Him. And about the cognitive triangle, this is the thought, emotion, behavior. Thoughts, emotions, behavior. This is the cognitive triangle. Actually, this is there in the Old Testament tabernacle also. In the holy place. I don't have time to explain all that. I think most of you from Christian background. The behavior or the will is represented by the golden altar, emotions represented by the golden lampstand, and thoughts represented by the table of showbread, and how when we surrender everything to the Lord can change our pattern of thinking and help us to have positive emotions and help us to prove and do and prove the perfect will of God, as we read in Romans 12:1 and 2. Many of those things I explained in many of my these things, YouTube videos. If you search Dr. Sandeep Psychiatrist Karunagappally or Dr. Sandeep Psychiatrist Kerala in YouTube, you can get to my YouTube channel. Dr. Sandeep Psychiatrist Kerala, Dr. Sandeep Psychiatrist Karunagappally is my YouTube channel name, and in which there are many videos based on the Word of God, as well as there is one playlist of videos where this mental health and counseling and stress and all are, even secular part is mentioned in one playlist, and the other, all the playlists are about the spiritual aspects of all that, about the stress management, how to think in a positive way, how to think more and more like Christ, spiritual ways to manage stress. The acronym C is used over there: casting your burdens, counting your blessing, consider from a higher and long-term perspective, crush to comfort others, conform to his likeness, closer in fellowship with the Lord, is clinging on to Christ. In the psychological ways, identifying the cause of stress, hobbies, taking a break, acknowledging your limitations, having good friends, guide, mentor, keeping our minds engaged productively, ventilation, sleep of adequate duration, that will have good cytokine regulation in your body, which will help in our immunity also. That's why even in COVID patients, we were advising good sleep, because that itself will improve the immunity. It will help them to tide over that viral infection. And forgiving others not only is spiritually good, but also is physically and mentally also good, because when you forgive others, there will be less of stress hormone productions in your body. The stress hormone, mainly cortisol levels, will come down, and then you will have more immunity in your body. So even secular research have proven that unforgiveness and hostility can result in calcification of even coronary arteries, as we say, hardening of our heart. And also, actually, unforgiveness and hostility can result in much stress and resulting in much of stress hormones, and that can impair immunity and all. And the happy hormones are serotonin, dopamine, oxytocin, and all. When we appreciate, we help others, and we do charity out of the love for the Lord, whatever we do, there is a more of serotonin release. Dopamine is the pleasure neurotransmitter. When you set time schedule and short targets and achieve them, there is a sense of accomplishment. There will be dopamine release. No need to depend on any psychoactive substances for dopamine release. That will impair your all the reward pathway only. But you can have pleasure and fullness of joy in the Lord's presence. Psalm 16:11. And oxytocin release. Oxytocin is called the love hormone, cuddle hormone. When you have good friends and when you are very close and intimate with your family members, there will be more of oxytocin release, and you will feel more happy. And the physical aspects like exercise and diet, avoiding junk foods and more of fresh foods and vegetables, and moderate non-veg, proteinaceous foods. And medicines are needed. If needed, to tide over some prices, there is no harm in some medicines. And emotional first aid, how to recognize that. These are my details. And even my phone number is available in Google. If you search Dr. Sandeep Psychiatrist Kerala, my phone number is given over there, and YouTube channel all are there actually. So in case anybody wants to reach out to me to guide somebody or your own clarification of any doubt, even for academic purpose or whatever, spiritual or psychiatric purpose also, you can feel free to reach out to me, WhatsApp me or call me, and all. So very happy that I could get this chance to speak to you people.